the right therapy started at the right time can actually mold the child's future.
Hi everyone, this is Dr. Sonam Kothari. I am a Pediatric Neurologist, a Behavior Analyst and a Special Educator. I'm a co-founder of Butterfly Learnings.
We have been treating multiple kids with multiple types of developmental problems, be it ADHD, autism, language and communication problems, learning disabilities, intellectual disabilities, and so on. What we have understood is if the child with milder symptoms like mild autism, mild ADHD, mild language and communication delays, if the child comes as early as 2 to 3 years of age and we start the intervention, in a continuous therapy of 1 to 1.5 years, the child able to discharge from the center. That means child gains the development of around 4 to 4.5 years of age that is needed to gain the further development for the child from the environment. What I'm trying to tell is you cannot teach the child everything and at every step of life. You have to give the skills to the child good enough to learn from the environment. So usually by 4 to 5 years of age, the child gains the required language skills and cognitive skills to learn from the environment. So to give these skills, if you start the intervention by 2.5 to 3 years of age, by 4.5, 5 years of age, he is age appropriate. Once the child gets age appropriate, the child can learn from the environment and we are not needed anymore to give them skills or to teach them skills. If we are able to give them the skills till 5 years of age, they might not require any therapist to teach them further. Just to give an example, a real life example of our kids, we have discharged almost 100 plus kids from the center who have come with multiple problems and with the consistent therapy of 6 months, 8 months, 1 year, 1.5 years, 2 years sometimes, have got discharged. Just to tell our first child, the child came to us at 3 years of age. He was having few words but no meaningful words or no meaningful communications. In a span of 1.5 years, when not even 1.5, 1 year, 2 months, when he actually became around 4 years, 3 months, he was in junior KG during that time. During that time, we were able to discharge the child with a complete communication, making stories, telling stories, describing what happened in school, good in studies, competing in gymnastics and competing in skating competition, and is doing absolutely fine now. He is now around 6 years of age and no complaints and doing very well in school. So early intervention, right therapy can actually help you to make your child independent and not require therapies in future.